We have a tagline called "Our lungs make our lives." There's just no question that most people don't think about their lungs, but if they stop and thought about it, breathing, something we do 22,000 times a day, and no one even thinks about it. So our lungs make our lives. So I think my message would be, don't avoid it. Don't be scared. If you think something might be wrong or you have reason to be concerned, go and get it checked out and speak to your healthcare provider about it and go get tested and diagnosed if there's an issue. And don't sort of shy away from it because of anything you may have been told about anything to do with your lungs in the past. So that's what I would encourage for people.
Welcome to Beyond the Wheeze, the podcast where perseverance meets potential. I'm Josh Realm, public speaker, marathon runner, asthma advocate, and your host as we explore the intersection of health, fitness, and resilience. Whether you're managing asthma, chasing a new personal best, or simply looking for inspiration, Beyond the Wheeze is here to show you that no challenge is too great to overcome. Together, we'll uncover stories, insights, and strategies to help you push beyond your limits. It's time to breathe deeply, move forward, and unlock your true potential, one step at a time. Today's episode brings us a powerful conversation on lung health, public policy, and the path to a smoke-free future in Canada. Jessica Buckley is the president and CEO of the Lung Health Foundation. Since stepping into the role in 2022, she's brought people-first leadership, bold advocacy, and a passion for change to an organization that's been working for over 100 years to help Canadians breathe easier. Before joining the Lung Health Foundation, Jessica spent years as a senior executive in the Canadian horse racing industry. She led major government and community initiatives at Woodbine Entertainment, helped shape a 680-acre entertainment master plan, and became a recognized leader across North America. Now, she's using that same tenacity to fight for Canadians living with lung disease. From the youth vaping crisis to air quality concerns and the tobacco industry's influence, Jessica had the clear message: lung health deserves a front row seat in Canada's healthcare priorities. With that being said, Jessica, welcome to Beyond the Wheeze.
Thank you so much, Josh. It's really nice to be here.
It's so great to have you. And just for a little bit of context for our listeners, we did get connected in January at the annual Lung Health Foundation's Better Breathing Week. I was invited to speak as a keynote for the social, and it was an absolute honor to meet you and the rest of the team as well.
Well, thank you so much, Josh. And it was really our honor to have you share your asthma journey. And it was very impactful for all of the healthcare providers that were there and our supporters, as well as the staff from the Lung Health Foundation.
I think having a patient voice, somebody who's not scared to speak up, who will be vulnerable and can share their stories, I think it's an important piece of the puzzle, and we can only see change because of it.
There's just no question. And I know we'll get into speaking about the power of people sharing their personal stories with elected officials and that advocacy piece. And it's so key to where we need to go with lung health in this country.
Absolutely. So let's jump into it, Jessica. I know you have a busy schedule. So we'll start by talking a little bit about lung health in Canada and where we stand. I want to start with a big picture question. Where does lung health rank on the list of healthcare issues we should be concerned about in Canada?
Well, in our world, it ranks extremely high because we know that 1 in 5 Canadians suffer from some type of lung health condition. And most people have someone in their family that is facing these lung health concerns. And what we see historically in this country is that it has been an overlooked and underfunded area of healthcare.
Yeah, as you said, 1 in 5 Canadians, that's huge, right? That affects a lot of households. But despite those numbers, it often feels like lung health doesn't really get the spotlight as other chronic conditions often do. Why do you think that is, and how do we change that?
Well, there's no question it does. And a lot of it just relates to stigma. And people that were suffering from COPD, which chronic obstructive pulmonary disease, many of your listeners are probably familiar. And lung cancer, there were high rates related to people that may have smoked in the past. However, there are many cases of people that have not smoked, and lung cancer rates in never smokers is on the rise. Unfortunately, it's almost at 30% of diagnosed lung cancer cases are people that have never smoked in their life. And the stigma that's associated with the lack of funding in research, the lack of funding in programs, it's really impacted generations of people. And many chronic diseases can be related back to lifestyle, et cetera. Some of people's choice and some of not of people's choice. I mean, there's definitely things related to the environment in which you grow up in and people's homes and what is happening in the air quality in their area, et cetera. So many pieces of the puzzle, and lung health is just a growing concern. And it's an area that there's so much that can be done prevention-wise and also diagnosis and treatment-wise. So there's a huge opportunity for improvement.
Absolutely. And I'll admit, too, the education around COPD, to be honest, I didn't really know much about it until I attended that event and I met Scott Bailey, which we had on episode 2, and he discussed COPD and the statistics behind it. And it was just sad, right? It's very common, and I feel like we don't shed enough light on it as, asthma and whatnot as well. So I do thank you for that, and Lung Health Foundation as well, for really spreading that word.
Well, thank you. And it's true. Many cases of COPD are undiagnosed. And even people that are diagnosed, they're just maybe not on the right treatment plan. Access to a test called spirometry, which is really the official diagnosis of COPD, it's just not there. And there's just maybe not enough knowledge amongst healthcare providers to be referring people in to spirometry and be properly diagnosed. It's very common. I have a number of family members that suffer from COPD, and it's challenging. And you're talking about typically seniors and people that are experiencing increased isolation because of this chronic lung condition. And if it's managed well, you can still live well with COPD. It's just being able to get the right medication and the right treatment plan.
That's right. And as you said, spirometry testing is imperative when it comes to diagnosis. So I'm 4.5 hours north of Toronto. For me to get spirometry testing done for whatever reason, or for somebody that needs to be diagnosed or better treated, it's really not that accessible.
It's true. And that's a great example, Josh, for people that are not living in urban centers. To be able to get access to that testing is so difficult. And there are some innovations globally that are things like spirometry in a box and some other ideas as to how to get that type of testing equipment to some smaller communities. But it's also the training that needs to happen for the healthcare providers to be able to interpret the tests and et cetera. So lots more opportunity on spirometry testing and access for people.
What do Canadians need to know about their lung health today? And whether they're living with a condition or not, are there things they can start doing now to protect their lungs?
Well, definitely. And I think what's most important is a message for anyone that's concerned about their lung health to speak to their healthcare provider about it and demand that they have some access to some of this testing, because the stigma that we spoke about earlier sometimes prevents people from speaking up about what they might be experiencing, because in the past, there was an attitude of, people asking, well, did you smoke? And things like that. And it's just, we're in a day and age where we need to care for ourselves and try to live as well as we can for the rest of the years that we have left. And so I would just highly encourage people to speak up and get diagnosed and get treated. So I think that's number one. Secondly, looking for access to programs that are going to connect people with other people living with similar types of lung conditions and finding that support, because it can be an isolating situation, and that's so important. And then, of course, early screening when it comes to lung cancer. So we've spoken about COPD, but lung cancer rates, unfortunately, they're not improving. As I said, there is 30% of lung cancer diagnoses are in people that have never smoked, so they may not meet the criteria to be screened. Many, almost 80% of people that are diagnosed with lung cancer are not diagnosed until stage 3 or stage 4. Now, there have been a lot of improvements in the treatments at those stages. However, you're limiting potentially the ability to treat it at an earlier stage and have a more successful outcome. So all of those reasons are reasons to speak up about your lung health and do what you can.
So how important is it for people to know the signs and get screened earlier in regards to conditions like asthma, COPD, and as you're discussing right now, lung cancer?
Well, definitely early detection is key in managing your symptoms and living the best life that you possibly can. We have many advocates, many of whom you were able to meet with when you visited us at the Better Breathing Week. And, we know people that are sort of diagnosed at all stages, and many of them are doing well, and they're doing well enough to be able to be out and advocating for us, which is fantastic. And that's thanks to the fact that they've got a great team of healthcare professionals. They're being treated. So I think the earlier, the better. There's just no question. And some of those diseases are chronic, but it doesn't mean that they can't be managed well.
Yeah, absolutely. And speaking of which, we had Katie Hulin here on an episode as well.
Oh, yeah.
And she has lung cancer, and she was just super inspiring. I think right now her episode sits as number 1 still.
Yeah, she is so inspiring. I honestly, every time I speak with Katie, I'm just amazed. She's an incredible person, but then when she tells her story and her outlook on life, she's incredibly inspiring, and she's been really a wonderful person to know.
Absolutely. I always look forward to speaking with Katie, and I'm hoping to get her on for another episode soon.
Good. That's great.
So let's move on now to tobacco, vaping, and the fight for a smoke-free generation. You've been a strong voice when it comes to the risks of youth vaping and the tactics of big tobacco. We're seeing a surge in vaping among young people.
Yes.
You've referred to this moment as Big Tobacco 2.0. Can you unpack that a little bit? And what are the implications of the settlement? And what are we facing now?
So a few things. Number one, vaping rates are on the rise amongst kids. So unfortunately, Canada has some of the highest youth vaping rates in the world. So this study tracked children between the ages of 15 and we're calling youth all the way up to age 29. But we know that there are many kids that are vaping in middle school and even younger. And the reality of it is that it's creating a nicotine addiction, nicotine dependency. And most kids that start vaping don't even know that they're vaping nicotine and that it's an addictive substance. They're really just interested in these enticing flavors, like mango and raspberry and, blue thunder. So it's really, it's a challenging situation, and the access to these vapes is unfortunately everywhere. We've really got a potential lung health crisis of the future on our hands with that next generation. That is a massive concern for our organization, and we're really talking about nicotine cessation and also a nicotine-free generation because, we know that kids who vape are 3.6 times more likely to start smoking cigarettes in the future. So also very concerning. And even being addicted to nicotine through the vapes, we don't have years and years of studies about vaping yet, but we know that 18-year-olds' lungs are not going to be improved by vaping multiple times per day. I mean, and there are lots of cases of lung-related injuries from vaping. Of course, the long-term effects of vaping are still being researched. It's really only been around for approximately 10 years. But look at what we thought about tobacco 50, 60 years ago as well, right? So what we've been advocating for, and you mentioned it, Josh, is something called a smoke-free generation or a nicotine-free generation. And that is a concept that has been successfully implemented in other parts of the world. It's still something that's gaining, I will say, it needs bold, brave government to be able to think of a policy like this. But the idea is that it wouldn't take any rights away from people who are currently vaping and smoking legally over the age of 19 in Ontario. But it would take any children that are born after a certain year, and they would never legally be able to access nicotine products, specifically vapes and other nicotine products that may pop on the market, because that's what we're finding is that the delivery of nicotine is just being added to the marketplace in other ways. So the nicotine-free generation, let's say the example was any children that were born after 2015, when they were about to turn 19, the legal age would then go to 20, and it would go up every year after that. So we've been speaking to the federal government about it. We've been speaking to provincial government about it. And we formed an advocacy group from lung health organizations from across Canada who are like-minded organizations, both national and provincial. And we call ourselves the National Lung Health Alliance. And that group has been doing a lot of advocating of elected officials.
I think that's incredibly important. And it rings a bell for me. I believe I was reading something recently that other countries have adopted this. I don't know if it was France or the UK. Please correct me if you know otherwise, but they're kind of adopting that approach as well to try to get people to quit smoking at least.
Exactly. So a few other countries that have made an attempt of this is the UK and also New Zealand. The previous government had it passed in New Zealand. The new government came in and walked it back. Unfortunately, as things happen, there are some examples out of the Philippines as well that have been very successful. And a tiny little town outside of Boston, Massachusetts called Brookline. So this small town of Brookline, Massachusetts decided that they would have a smoke-free generation in their town limits. And obviously their elected officials felt very strongly about it, and they've implemented it to set an example.
Right. Because, I mean, in regards to vaping, we're hearing more and more about the harms of vaping. As you said, there's confusion there because we don't really know to the extent of it yet. Unfortunately, a lot of people still see it as not that bad or, you know, a quit aid to smoking. But the research does tell a different story.
Yes.
That's a big issue.
It's a big issue. And the truth is that's how it was marketed off the top to policymakers and to Canadians. And the truth is that if someone has smoked tobacco for 40 or 50 years, maybe it will show that, you know, they're a little better off potentially by moving to other ways. But, you know, there are other ways to do nicotine replacement therapy that do not involve inhaling anything in your lungs. Of course, we believe that nothing should be inhaled into your lungs other than clean, pure air. So it makes a lot of sense logically. And then when it comes to kids, having them get hooked on vaping and essentially addicted to nicotine, it's just causing a mental health issue for those children as well, right? Because they feel stressed, they hit their vape, they've got the nicotine high for, you know, say 30 minutes or so, and then they start to feel anxious again and they want to hit their vapes again, and it's just a big cycle. And these vapes have regulations where they can only have 20 milliliters of nicotine in the vape, but there's lots of illegal vapes that are sold with double that amount. Some kids are hitting one of these vapes in a morning and it's the equivalent of smoking a pack of cigarettes. So they don't even know what they're having in their system, and they've got developing minds and bodies, and it's really a challenge.
So you had mentioned that youth who vape, they are 3.6 times more likely to smoke in the future, which is sobering because a lot of people see it as a need to quit smoking. What do we risk if we don't act decisively now?
I think we risk the future lung health, mental health of this generation. You know, I have kids in that age group, and the prevalence of vaping is just massive. And of course, we live close to a high school, and I see the kids out at lunch, and they're also vaping in the classroom, and no one even knows. They have them tucked up their sleeve, or, they're hiding them. So I just think that we are unfortunately going to see some future lung health issues and some mental health stuff, because anyone becoming addicted to any substance is really challenging for them to face in their lifetime.
What practical steps can individuals, parents, schools, even listeners of this podcast take to help create a smoke-free generation?
Well, I think there's a couple things. One, helping join our movement as an advocate for the Lung Health Foundation, I think would be wonderful if we have parents or teens, young adults that are listening that would like to help us advocate in Ottawa. We will be heading there later this year as the National Lung Health Alliance, and love to have you come and share your stories and share your voice. Secondly, for any parents that are listening who want to speak to their kids about vaping, we all remember what it was like to be that age, and you don't want to listen to a teacher or a parent telling you something's bad for you. But there are ways to get at the conversation. And we have a lot of tools on our website, and we have a program that we've developed called the QUASH program, and that's QUASH, QUASH. The QUASH program is really, a list of questions that parents and or teachers can ask their young people in their life about their vaping habits and get at those questions. And then for the kids and or adults, anyone who would like to quit vaping or smoking, we have a free app that can be downloaded on any smartphone. It's called the QUASH app. And it's really just a quit program and a tracker where you can track your cravings. You can track how much money you're saving. You can connect with friends in your community if you're trying to quit together and things like that. So the QUASH program is something that we rolled out in many Ontario schools last year, and did webinars also for parents and teachers, just so they could learn about how to talk to kids about vaping.
I'd love to zoom in on you for a second. You came into this role after a long and successful career in the racing and entertainment industries. Now you're leading a national health organization. What brought you to the Lung Health Foundation, and what keeps you passionate about doing this work?
Well, I feel so lucky to be working with a health charity. It's extremely rewarding. And for me, I loved my career in horse racing and gaming and entertainment. It was a wonderful, exciting career. At one point, I had worked closely with community partners and charities, and also closely with the provincial government mainly, a little bit with the federal government, but a lot of government relations. And I just decided that it was time in my career to take my skills and be able to help out on the nonprofit side of what we're doing. And of course, healthcare is really at a crisis point in this country, and health charities fill a lot of gaps across Canada where we just don't have the capacity at the hospitals, and the doctors at the primary care offices don't have the time to spend 30 minutes with a patient, walking them through how they can live well with some of these lung conditions. So that's really where the health charities come in. So I was connected to this cause because of my own family's relationship with lung disease. And I mentioned earlier, I have a number of family that lived or did live with COPD. My father was an asthma sufferer his whole life, and I think mostly really unmanaged asthma. And I grew up on a farm, so he was in the barn and it was hay season and, all sorts of challenges for him. But, I really connected with the asthma work that we do at the Lung Health Foundation. And then lastly, I've lost 2 family members to lung cancer. And one, after I joined the organization, was diagnosed stage 4. And so, there's just no question that it impacts so many people's lives and so many families' lives across this country. And lung health has been a bit of an underdog, as we spoke about earlier, and really being able to champion that cause and do what I can do to help has been incredibly rewarding.
Absolutely. So I can relate to working on a farm.
Yeah.
When I was young, I worked on a farm and I have severe asthma.
Yes.
I was allergic to everything in that barn. The education just wasn't there. My family physician, even my specialist, wasn't there to tell me, you probably shouldn't work in this barn. But, fast forward to years later, organizations like the Lung Health Foundation or Asthma Canada, they've helped me with realizing that those situations, they really exacerbate my breathing and make things worse.
Yes.
So those educational resources that you offer, they're huge, and most of all, they're free.
Yes, exactly. And because of, we are a national health charity, so we rely on our donors to help support the programs that we offer and also the creation of the resources. They're all clinically vetted and evidence-based resources that we have on our website and our programs. So all of the donors help support that work, and we are able to offer it for free, which is wonderful.
Since taking on the role of CEO in 2022, you've helped reposition the Lung Health Foundation as a bold and proactive voice for change. What's your vision for where the organization is heading?
So we are undertaking a new 3-year strategic planning process as we speak. So we will roll this out at the end of this calendar year. And we've gone out to speak to all of the stakeholders across the country, and that's people with lived experience, our researchers, our healthcare professionals, members of our board and community, and of course our donors. So I'm really excited to hear what they think at this current moment. From my perspective right now, it's really about the advocacy and putting lung health with policymakers where it needs to be, and having a proportionate amount that's commensurate with the burden of the disease invested in lung health and lung health research and lung health programs. So I think that's incredibly important. So our federal advocacy, I mentioned research. Lung health researchers they have been underfunded as well for many, many years. And we relaunched our research program last year, and we're very proud that we have a number of young up-and-coming lung health researchers that have received funding through the generosity of our donors, who we then are able to award these grants. And we have many early career and mid-career researchers. And our most current grant is for an innovation grant in lung health. So I'm very excited about that as well.
You've mentioned how important it is to build lasting relationships across sectors, government, healthcare research, and patient advocacy. Why is that collaboration so essential when it comes to lung health?
It's so essential because when you think about making change at the political level, hearing from people who are with lung disease or caregiving for someone who is living with lung disease is absolutely critical. They expect the message from the Lung Health Foundation. They know what we're coming in with. But when they hear from everyday Canadians that are facing these issues because of where they live, or because they don't have access to spirometry, or they don't have access to lung cancer screening, that's really what's critical and is going to help us move the needle. Certainly on the youth vaping file, being able to hear from high school students or middle school students or young adults whose friends have suffered because of their addiction to nicotine and vaping. So I think there's no question that having the people with lived experience and their voice, that's the key to the success.
Absolutely. They make it relatable, and it's certainly helping to end the stigma as well.
Exactly. End the stigma and connect with others that are experiencing similar things. And we also have a great resource on our website, Lung Health, which we call, it's a network, a community network called The Loop. And it's all about kind of staying in the loop and being looped in with others. And there's just a number of resources on there that are wonderful for people, and they can connect with others.
So let's move on now to the broader landscape. So in regards to air quality research and really what's next, we've seen the growing impact of air quality issues in Canada, especially from wildfires. Mm-hmm. For people with asthma, COPD, or other lung conditions, it's not just an inconvenience, it can be a serious threat. How is air quality shaping the future of lung health in this country?
So it's really, air quality has always been on the minds of people that have breathing concerns. But for others, I would say that in Ontario, it really came onto the scene in the last 2 summers when we've seen all these wildfires burning in Ontario. People in other provinces were very accustomed to wildfire season, but I don't think we had seen anything like it in Ontario like we did over the last 2 summers. It's only going to be increasing across North America, unfortunately. So it's a big concern, and it's a very big issue to try to tackle for governments. And it's definitely something that we speak to when we go to Ottawa and speak to elected officials up there. We have focused on indoor air quality as something that is a little more accessible as far as trying to control things. So being able to have HEPA filters in your home for people that have lung conditions, speaking to people in our network about staying indoors and air conditioning, keeping windows closed on days where wildfires are raging or the air quality is poor. And, there's great air quality indexes that you can follow online and know these things ahead of time. So the indoor air quality is a little easier to control than the outdoor air quality, but tackling the wildfire, it's going to take governments from everywhere to work together to make that happen.
And it needs to be nonpartisan as well, right? It needs to be somewhere that we can all meet in the middle. I mean, we have the elections coming up. If they're not already, I don't even know what's going on in this country anymore. There's so much going on down south that I have all my attention there. But we need to create something that can last. I mean, you had mentioned earlier that governments in other countries walk back these policy changes on smoking, but we need to make sure that doesn't happen here.
We do. And I just urge people to speak to their local MPs after the next federal election and, speak to them about their lung condition and also about their air quality concerns, because it's real for all Canadians, but especially those living with lung conditions.
Beyond prevention and awareness, we know that research plays a key role in changing outcomes. What are some of the emerging trends in lung disease research or innovation that give you hope?
So we've been really excited about our research program and some of the submissions that have come in. And specifically, we have one around innovation. So we're trying to keep our finger on the pulse. A few things that have changed in lung health in recent years is really using biomarker testing for lung cancer treatments. So that's being able to take a small sample of blood and determine what type of lung cancer someone has and being able to treat that. So biomarker testing is great. Also, the innovation of immunotherapies have been incredible to help people that are living with later stage lung cancer to be able to live well. We're also seeing a lot of trends using AI. So, AI health research is a huge trend that's exciting because you can be able to distill down trends and patterns and make connections so much faster as well. So I think those are some of the things that we're really excited about. And it's really those targeted therapies and the precision medicine that I talked about with biomarker testing as well.
When we think about lung health, we often focus on the individual level, but community matters as well. What are some ways communities across Canada can step up and get involved in promoting better lung health?
I think being able to support your family members, number one, and to have these conversations about lung health, because you probably know someone that maybe has a chronic cough or, potentially might be suffering and just not sharing it with their family, and really encourage them to talk to their doctor and look for a diagnosis if that's relevant. And visit our website and use the resources that are there, whether it's someone who might have asthma, COPD, lung cancer, or learning how to talk to people in your life about vaping and smoking cessation. I think that's a great way to be involved. And then I'll just reiterate again about the importance of being an advocate. There are ways to do it that don't include having to travel to Ottawa with us. We have some great pages on our website where you can send a letter directly to your local member of parliament or a member of provincial parliament and get it off to them, talking about the importance of lung health and how there needs to be policy and investment in lung health. So there's a number of ways that you can help in your local community.
And now zooming way out, what do you see as the most pressing lung health issue facing Canadians today?
Everything we've discussed, it's hard to say one over the other because, things like air quality, the extremely high youth vaping rates and smoking, all of those things are a concern for lung health. Really, access to diagnostics and access to screening is not available for many, many Canadians. Ontario is rolling out a lung cancer screening program. They're currently in 4 cities and they're going to go to 12 plus cities in the next year or so, which is a huge improvement. However, there are a number of small communities that still it will be a very big trip to get screened for lung cancer. And spirometry, we discussed that earlier, not having access to spirometry. So I think that it really starts with elected officials looking at the healthcare priorities and realizing that so much of the health issues that are related to lung health are very costly to the system. If not diagnosed and treated early, these exacerbations that happen with COPD and then potentially late-stage diagnosis of lung cancer, very costly to the healthcare system. And we can do much, much better by investing early in both prevention and also getting people diagnosed and treated.
I couldn't agree more. I think that's a terrific answer. As you said, there's no one issue really that outweighs the other. It's a conglomerate really of the issues.
It is, yeah.
So I do have one final question for you, Jessica, a question that I ask every guest that comes onto the episode. So whether you have asthma or not, every breath we take is a gift, a reminder of our resilience, our drive to keep going, and our power to define our own limits. With a single breath, you have the potential to move mountains and change the world. So with that in mind, again, I have one final question for you. If you had only one last breath, but with it the power to influence the world, what would your message be?
Gosh, such a great question. We have a tagline called "Our lungs make our lives." There's just no question that most people don't think about their lungs, but if they stop and thought about it, breathing, something we do 22,000 times a day, and no one even thinks about it. So our lungs make our lives. So I think my message would be, don't avoid it. Don't be scared. If you think something might be wrong or you have reason to be concerned, go and get it checked out and speak to your healthcare provider about it and go get tested and diagnosed if there's an issue. And don't sort of shy away from it because of anything you may have been told about anything to do with your lungs in the past. So that's what I would encourage for people.
Jessica, thank you so much for joining me today and sharing your incredible insights. Your leadership and advocacy are truly inspiring and a reminder that while lung disease is a challenge, there's always hope and there's always room for change.
Yes.
To all our listeners, if this episode resonated with you, please share it, subscribe, and leave a review. And you can learn a little bit more about Jessica's work and the Lung Health Foundation at lunghealth.ca. Also, with every new episode, including this one, I release an in-depth blog featuring additional insights and resources. Be sure to check that out on my Substack through the app or visit beyondtheweeds.ca. Until next time, keep pushing forward, keep breathing deep, and never let anything hold you back. Thank you for listening to Beyond the Weeds. If you enjoyed this episode, don't forget to subscribe and share. Follow us on Instagram at Beyond the Weeds and or follow me at the Asthma Runner for more updates. Keep breathing strong and remember, your potential has no limits. Until next time.